How does the Juvederm process work? I'm interested in getting my lips plumped. I want fuller lips and to have a less gummy smile. So how long does it take to do filler? How long is recovery? How often do you have to get lips refilled to maintain? General cost for lip filler? Any other important information I should know or consider?
Thank you for your question. You submitted some photos and you're asking how does this Juvederm process work? And you state in your question that you want fuller lips to address concerns about a gummy smile. And so naturally you're asking about the frequency, the cost, and just how does this whole process work? Well, I can certainly assist you. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic surgeon. And using fillers is a part of my practice that we do every day, in particular to help people with lip aesthetics. And I think that one of the things that you're probably doing, which many people do, is you're really getting ahead of yourself by going straight to a solution like Juvederm for a question or concern that has to do with a gummy smile. And that's not unusual. A lot of times people use the term like Botox to mean essentially anything that helps wrinkles. Certainly the people at Allergan like that, but it's to understand what is the mechanism to help you improve your appearance. Now, being a practicing specialist for over 20 years and having used the original collagen, Zyderm and Zyplast, and then going to Restylane and now all the other fillers, I have a lot of experience with these fillers, and an unfortunate byproduct of the popularity of fillers is that everyone is now very negative about the appearance of lips on people who are celebrities or people who think they are celebrities. And so I think it's very important in your situation with the photo you submitted. It appears you're very young, and I would caution you about using a lip augmentation strategy as opposed to some other option to address the gummy smile. In fact, Botox, speaking of Botox, Botox is used to help people with a gummy smile make the smile less gummy. And that's a treatment that can be applied in your situation and could be done more, a couple of times a year in terms of the question of frequency. I would caution you again about the volume correction on the lips. It is very easy, especially on a younger person, to overdo the appearance of the lip and make it look artificial. A younger person, even if they have naturally thin lips, still has a certain proportionality to their lips that, if it's thrown off, can look very, very artificial. I think that it's very important that you understand that if you're going to do anything like a filler, that the filler's response in you is going to be individual. There are some general rules to the longevity of the fillers, and there's kind of a spectrum from the least viscous or the least thick to the most thick. So from like Restylane all the way to Voluma. But Juvederm or Juvederm Ultra Plus are popular fillers for lip enhancement as well as Restylane, and and there are certain FDA-based studies that show how long they last. But practically speaking, there is still a wide variability, and so you have to understand that when someone comes to me who is in their 40s, a woman in her 40s comes and the lips are getting thinner and some vertical lines are forming, this is a very different scenario where I try to focus on restoring the outline of the lip, restoring volume, and then using my own artistic style and of course the application of the golden ratio to the proportion of the lip so it looks like a correction and no one can tell that they had lip augmentation. And that's a very different scenario from a younger person who's trying to treat something else by blocking it with lip augmentation. I think it would not work out well in terms of the overall aesthetics. So I would recommend you meet with some practicing doctors who specialize in fillers and learn about your options. You know, like I said, consider trying Botox. There are also some surgical procedures that might be worth considering. I think that a lot of times the gummy smile situation also has to do a lot with the way the teeth are set in terms of the jaw and the jawbones. But without getting ahead of ourselves in that respect, I mean, you can certainly meet with an oral surgeon or a dentist. But the gummy smile issue does not have to be necessarily indirectly treated with Juvederm. It can probably be treated more directly. So again, meet with doctors and get some opinions and learn about your options. But I would say start very conservatively. I think Botox is probably the most conservative. Worst case scenario, if you don't like the results, it wears off. And I don't mean just Botox, but Dysport and Xeomin are also in that same category of a treatment that inhibits a nerve impulse, which is what is responsible partially for the gummy smile. So I hope that was helpful. I wish you the best of luck, and thank you for your question.